Welcome to RareOnAir, the monthly podcast from Eurordis, Rare Diseases Europe. I am your host, Julien Poulain, and once a month, we will be exploring the challenges, experiences, and successes of people who live with the rare condition. In today's episode, I'm joined by Julián Isla from Spain, a rare disease advocate, artificial intelligence expert, and father to a son with Dravet syndrome. Julián's journey into the world of rare diseases began with his son's diagnosis. Obtaining this diagnosis had been a long and challenging process, but it would inspire Julián to create solutions for others facing similar struggles. As a manager at Microsoft, Julián leveraged his professional expertise and personal experiences to co-found Foundation 29, a non-profit organization dedicated to revolutionizing rare disease diagnostics and care through the power of data and artificial intelligence. In our conversation, Julián delves into how AI is already reshaping the rare disease landscape by allowing for faster, more accurate diagnoses and by empowering clinicians and patients alike. This genuinely thought-provoking discussion also reveals Julián's compelling vision for the future, a future in which AI plays an ever greater transformative role in healthcare. Julián also shares with me his insights into the cultural and regulatory barriers that must be addressed to unlock AI's full potential and radically improve the lives of people living with rare diseases in Europe and beyond. Julián, thank you very much for joining me.
Thank you so much for the invitation to join the podcast.
It's great to have you. No, thank you. So I'd like to begin by asking about your initial story of your family being impacted by rare diseases. How soon after your son Sergio's birth, I believe in 2009, did you realize that something was amiss? And what challenges did you face in getting a diagnosis from that point onwards? Was it quite a long diagnostic journey?
Well, it was not so long. If you compare the average of years patients with rare diseases need to get diagnosis is around 4, 5, 6 years. The first symptom of my son was the seizures, epileptic crisis. The seizures started when he was 3 months old, and we get diagnosis when he was 1 year. So yeah, nine months, which is okay if you compare the time to diagnosis with the majority of people. But the problem is my son has Dravet syndrome, and if you don't have the proper diagnosis, probably you will have severe consequences, because the problem is Dravet syndrome is in the neurons. It's a problem with sodium channels. And if you put the patient in the wrong treatment, you have a more severe condition. And this is exactly what happened, because we didn't know the diagnosis of Sergio. We put Sergio in a bad treatment. The seizures went to the roof. And that's the importance of diagnosis, right?
Yeah, absolutely. And when you did get a diagnosis, what was the experience from that point onwards? Did it result in any treatments that were able to deal with Dravet syndrome directly? How much of a difference did it make to the quality of his life and the quality of your family's life?
For us, the diagnosis was very important because we were able to change the treatment. Sergio was in a wrong treatment. He was having 20 seizures per day. And because of the diagnosis, we changed the treatment and we went to the baseline, which was at this time 1 seizure per month, which is much better.
How would you explain Dravet syndrome to someone who may not have heard of the condition before? Might you also know how rare it is? What causes it? And of course, you mentioned the seizures, but are there a broader array of symptoms?
Well, the prevalence of the condition is around 2 or 3 per 10,000 patients. Remember, in Europe, the threshold for rare diseases is 5 every 10,000 patients. So we are in the middle. No super rare, not super frequent, just in the middle. The physiopathology is based on a problem in one gene called SCN1A, and this creates a lot of problems. The most obvious problem are seizures, because they are very easy to recognize, but it's just the top of the iceberg, because below the iceberg, there are cognitive issues, behavioral issues, because the brain is not working properly.
I see. And how has his development been since he was first diagnosed with it? I understand he's 16 years old today. How impacted is his life by his condition and maybe by extension your family's lives?
Unfortunately, the phenotype of Sergio is in the severe spectrum of the disease. He has already multiple symptoms on top of the seizures. He's not able to talk. We have to feed him, and he needs 24/7 support. That's the main problem we're facing, because this means that we have to be caregivers all the time. As you can imagine, this has a strong impact in the family, because one of the problems we are facing right now is behavior. When Sergio was a baby, behavior was not really a big deal. He was small and easy to manage. But when he is getting bigger and older, the behavior is getting a problem, because you need to move for managing a baby to managing a teenager. And also, we have been struggling with the disease for 16 years. So every day we have less and less energy.
I can imagine that the social impact of the condition is pretty high. But on the medical side of things, have you been aware of many scientific advancements in treatments or healthcare for people who live with Dravet syndrome?
Yes, because I have the opportunity to be involved as patient expert at the beginning in the European Medicine Agency. I'm a member of the Orphan Drug Committee, and I've been working with this committee the last 10 years. So I'm very familiar with the development of new treatments for Dravet syndrome. I've been involved in the designation and marketing authorization of 2 new drugs during the last 16 years, but they are symptomatic drugs. They are drugs able to treat symptoms, but they are not solving the root cause of the disease. And this is more or less the situation in most of the rare diseases, right?
Yeah, no, it's definitely the case that the vast majority of rare diseases don't have a treatment that tackles its root cause. Do you feel optimistic about such a treatment coming in the lifetime of your son, or is it hard to tell?
It's late. The brain is mostly already developed. The new treatments working on CNS, central nervous system, they are effective when the patient is young. Unfortunately for Sergio, I guess this is late, but it's fine. I mean, the community and my family is working in order to make sure the pain we had with Sergio can be used for the future, and other patients in the future could have better treatments. Right now, there are promising treatments in development involving gene therapy, which is oriented to fix the problem, fix the gene, and other treatments using RNA mainly, and trying to modulate the expression of the gene. And these treatments, they have the potential to change the disease. We don't know exactly how far and how much, right? But definitely they have the potential to change the life of maybe the next patients.
Well, that is really promising to hear. So it's at this point I would actually like to move on to talking about what you've brought to the rare diseases ecosystem, and talk about your history with seeing a role for artificial intelligence in improving the lives of people who live with a rare disease. What was your first entry, perhaps way before your son's diagnosis, into the world of artificial intelligence?
Well, the expertise in artificial intelligence is mainly coming because of my professional work, because my full-time work is in Microsoft. 8 years ago, before the AI hype, I realized that it was going to be important in medicine and science. And I created Foundation 29 with other board members with the idea of explore how AI can improve the life of people living with rare diseases. Our most important project has been diagnosis. We have been working on diagnosis support tools the last 7 years. We have been involved in the transition from how artificial intelligence was able to support diagnosis to right now where artificial intelligence is able to drive, which is totally different. And we were able to see how artificial intelligence is getting more and more important.
The initiatives you're running at Foundation 29 are really interesting and impressive, and I'm shortly going to ask you about how they work and what kind of results they've borne since. But I guess one platform that many of our listeners would be familiar with when it comes to artificial intelligence is no doubt ChatGPT. Given your position at Microsoft, did you anticipate the launch of ChatGPT in November 2022? And how did the release of ChatGPT impact Foundation 29? Did ChatGPT compare much to other AI technologies that you had encountered? And it'd be interesting having your insights on the topic, given how big of an event the launch of ChatGPT has been.
It's a great question and very, very complex. The most important change in artificial intelligence field has been the large language models. This is the way we call ChatGPT and the model behind ChatGPT, right? 2 years ago, when ChatGPT appears, something very important happened. The large language model showed to us that we can use the power of language for almost everything. Most of the activities we do as people, they are based on language. Right now, we are using language to communicate and create this podcast. And that makes the use of large language model so powerful because it is the first time in history that we have a general purpose artificial intelligence. And in our first experiments with DXGPT, which is the diagnosis tool that we created based on GPT-4, the model behind ChatGPT, we realized that the model was doing impressively well in clinical diagnosis. And we created the first version of the XGPT, and we started to do analysis and tests using the tool. And we realized that the tool was very, very efficient providing diagnosis. And we are still developing this because we can see the value is already there. Right now, we are in a situation where the GPT-4.01, the latest model, is able to perform in a much more better level than trained physicians, which is a new scenario. It's something that probably is going to change the way we are doing medicine, because if I can choose between a physician using a large language model or a physician alone, I will choose the first one, for sure.
Yeah, that's a really interesting point to make. What would you say is, in simple terms, the process for creating a GPT like the one you did?
Well, in a very simple way, I will say it's based on data, mainly. The performance of GPT or all the models that most people use, they are based on huge amount of data. Medical area is one of the areas where the quality of information is better. You try to identify, information about rare diseases, for example, and you go to Orphanet, you go to OMIM, the databases where the data and the conditions are described, you will find very curated and very high quality information. If you are taking, medical literature, the papers from PubMed, the Harrison, the typical books, all the physicians they are familiar with, you will have the perfect combination. You have data plus knowledge. That means that medical area, the large language models perform very well. And it's perfect for these models. Semi-structured data plus knowledge of the data. That's perfect. That's the perfect combination. And this is exactly how the large language model, they work, When this area of development was at the beginning, the problem was the access to the data and the capability to compute the data.
I see. No, that's really interesting. Have you learned of any stories by any chance of people already benefiting from your tool in diagnostics?
Oh, yes. It's difficult to quantify how many people, because we are not asking personal information and we are not storing data from users in order to be GDPR compliance. And, so we don't have structured information about the people we diagnose, but we have the testimonials of the people, because we are asking users to provide a very basic score from 1 to 5 in terms of clinical accuracy and usability, and also a text box where they can put messages about the use of the tool. And the feedback is fantastic. And it's super rewarding to see how physicians are telling to us, oh, thank you guys, because your tool saved the life of my patient. We have one example of one physician telling us that the patient he was managing has sepsis, but the sepsis was misdiagnosed because the clinical presentation was rare.
Right.
And the physician used the tool, and the tool pointed the physician to sepsis, and the physician identified the sepsis. And this is a great example of how artificial intelligence can improve the work of physicians, because AI can point you to places where you never will be alone.
It does sound like a perfect example, because my impression is I feel like those who criticize or diminish the potential impact of AI often do so according to the argument that, oh, well, it gets things wrong as well. Or, oh, well, we should really defer to experts in these areas. Whereas, in fact, the experts or the professionals in any of these spaces, including medicine, they should really just be using artificial intelligence as a guide or as a tool that they oversee. In your experience, do you feel like clinicians themselves appreciate the potential of AI in rare diseases and in healthcare more broadly?
Well, based on the testimonials we have in our tool, probably they have a strong bias because they are coming from users. And if you are using our tool, it's because you have interest. So it's very difficult to make extrapolations of general perception of a community based on the feedback we have, because the feedback we have is great. when you are working with physicians in clinical hospitals in these institutions, because we ran clinical studies in hospitals to check the efficacy of this tool.
So you can actually run a tool like this through a clinical trial?
Oh, yes, because what we did, for example, with this clinical study, more than a clinical trial, was to create two groups, and we compare the diagnosis performance of both groups, right? And that way you can measure the accuracy of the tool. We have people saying, nah, this isn't going to help. I'm a doctor, and this is a machine. I am always better, right? But on the other hand, there are people saying, yeah, I'm aware of my limitations.
Right.
I want a tool. Why not? And the problem with medical diagnosis is we never measure the efficacy of our doctors right now in diagnosis. For example, if I ask you, what's the diagnosis success ratio in France for rare diseases? Nobody knows. The same in Spain, the same in other countries. Nobody is measuring the failure. When my son was diagnosed in the wrong way at the beginning of the disease, I'm not blaming the physician, not at all, right? Because this is the best he did with the tools he had. And this is exactly the problem.
Do you feel optimistic that actually things like clinical trials of your platform and perhaps indeed any other AI tools, do you feel optimistic that such studies conducted in this standardized way will actually bring forward a new era in healthcare? Can you even see them being more formally prescribed to physicians?
I'm very, very optimistic on this direction because, for example, right now we are working with the regional healthcare service in Madrid, and they have been using our tool for 1 year in primary care.
Okay.
In other words, every physician in Spain working on primary care, they have access to our tool, and the tool is embedded in the tools they use. And it is also embedded into the primary care processes. In Madrid right now, where a physician has a patient with a suspicious rare disease, the physician can use our tool, identify potential conditions, put this information in the EMR, in the medical electronic record system, and send the patient to hospital for final diagnosis. This is happening right now.
Right.
And after 1 year, we already diagnosed a couple of dozens of patients with this. And right now, we are starting another project with Catalonia, the area of Barcelona and broader, in order to test the tool in specialized service in hospitals to prove that the tool can be also used in hospital as well. So this is coming, and we are getting more and more attention into this. The next step for us will be to put the tool into a special program the Ministry of Health in Spain is creating for patients with rare diseases in Spain, and our tool probably will be a service that all the hospitals in Spain will have access to. And this is our strategy.
Oh, wow.
We are a non-profit organization. We are not able to build systems in scale and make sure everybody use our tool because it's going to be impossible to sustain for us the value of this type of solutions and make sure the healthcare providers are taking the solution and they are implemented. This is the way we work.
Well, that's really impressive that you've made such great strides. I mean, perhaps it's not entirely surprising given how much focus there has been on artificial intelligence, particularly over the past 2 years. But congratulations on that level of progress. What would you say, though, might be the main obstacles to artificial intelligence being fully embraced? Might they be regulatory or might they be cultural, or what would you say those obstacles are?
Probably it's a combination of those examples you provide. One, the regulatory barriers are already there. That this is something that you are reading the AI Act, the European Regulation for Artificial Intelligence. The regulatory investment you have to do in order to make these type of tools in production, they are very high. If you are a big company like Microsoft, Google, Amazon, IBM, you have the lawyers, you have the resources, fine, you can deal with the regulation. But if you are a small or medium, maybe you don't. And this is the area where we are facing much more risk as Europeans. The other issue is the medical regulation. For example, in Spain, when a physician is having the medical license, the physician doesn't have to pass any exam anymore. The physician can start to make mistakes and nobody will check. In the other hand, we have tools like this where we are asking 95% of accuracy every time for all the cases. The comparison is not fair, My point is, we need to start to ask the patient, what do you prefer? Because we are not asking the patient. We are taking decisions in most of the cases on behalf of the patient. And this is one issue with AI, right? We are taking decisions to protect the patient, but we are not asking the patient if they want to be protected in that way. In most of the cases, the physicians, they are not engineers. In my conversation with most of the physicians, they don't understand the technology. And they have the typical feeling of fear. I guess the Terminator image is coming to their minds when they are thinking about AI, because they don't understand how this works. This is a cultural thing. And they have this resistance to change, which is very natural to humans. You know what I mean? I have a super strong opinion on this. I don't see a space for humans in medical decisions in the next years.
Oh, wow. That's quite an interesting point of view.
I know. And I know this is going to be super controversial. But the thing is, working on this field the last 15 years, the 10 last years on diagnosis, the complexity is getting bigger every year, right?
So you don't believe it's plateauing its potential?
No.
Or
the complexity, not. The complexity is getting bigger.
Right.
What is plateauing is the capacity of the people. With this combination of capacity of the people limited and complexity being increased, I don't see a space for humans.
So do you see like a widening gap?
Oh, yeah, some kind of. But it's the same that happened with pilots, in the aeronautic industry. Flying in the 60s, the 70s was mainly based on humans. The humans did all the work.
Yeah.
But when the complexity of the plane was increasing, the plane makers, Boeing, Airbus, they decided to give more complexity to the computer. And right now you can see that's different if you see a picture of a plane from the 70s compared to a plane of the latest Airbus. And in most of the cases, the work of the pilot is to supervise the activity of the computer, because flying a plane alone is impossible right now for most of the planes.
Yeah.
It's going to be the same issue with medicine. How can a physician diagnose more than 10,000 rare diseases? And how they can memorize the treatments needed. The combination between symptoms, physiopathology, genes, treatments, drugs interactions is impossible for humans. The only person with the full view of the disease, in most of the cases, is the family of the patient, because the complexity is so huge that it's not able to manage this complexity. And also, we are facing a healthcare service where the system is based on the acute process. If you have a heart failure right now, the healthcare system will solve that problem tomorrow. But when you are living with a rare disease, the problem is systemic.
Right.
And everybody cares about what happened in the hospital, but nobody cares about what happened at home. If you are tired, if you have stress, your financial situation, how the stress is affecting the patient, the family. Based on these huge challenges, the only solution I see is look for more automation, look for more systems able to support the activity of the humans at the beginning. But more and more, we will see how the main activity will be based on non-human intervention, probably.
No, it's definitely some spicy food for thought for lots of our listeners.
Oh, yeah.
Some of which who may be less enthusiastic about what you envision, irrespective of the, prospects for rare disease patients themselves. But it's really interesting hearing you outline that possible future.
But in any case, the community of our listeners to the podcast is people like me.
Yeah.
We are alone in the system, right? I have to manage the intervention of my son. I have to manage the coordination of the appointments. I have to manage the medical records. And in most of the cases, families are contacting me because they are looking for help. Yeah. So we have strong signals that the system is not working for us. If the system is not working for us and something better is coming, we will go for the better.
Yeah.
And when the people say, but the doctors, they have empathy, I don't care about empathy. I care about results and value.
No, it makes sense. Given the deficiencies that many healthcare professionals have, even, for example, with regard to the way that they deliver a diagnosis to someone. I mean, we've heard plenty of stories of healthcare professionals delivering a diagnosis over the phone during a busy workday. Well, of course, that does require cultural change in and of itself, and that's perhaps a separate issue, but it does highlight problems with that particular argument that you've cited about human medicine being inherently more empathetic and more important.
But the cultural change will come also because of the generation change. In the past, the healthcare professionals, they have the prestige of the knowledge. So you trust them because they know things that you don't know. But right now, we're in a new situation because everybody can use advanced models in ChatGPT, and you can ask the same questions to a ChatGPT. And probably in most of the cases, ChatGPT will provide much more better and empathic answers than your doctor. And this changed the status quo. And also, as you say, they don't have time right now for us because they have to type most of the time in front of the computer. So what they have?
I know I haven't got too much longer in the conversation with you. Might you be able to just give us a run through of some of the other initiatives that Foundation 29 has been working on to improve the use of AI or discover new uses for AI in these areas other than diagnosis?
We are not working on medical research, but definitely this is an area where AI will be very, very important as well, especially with the example that we have of AlphaFold, the model from Google, because the Nobel Prize for chemistry this year went to a computer engineer for the first time in history, the guy who developed AlphaFold. AlphaFold is a machine learning model to realize how proteins fold. It's an important problem in biology because the way the proteins are folding is important for creating new medicines. The Google guys, they develop a super and creative way of predicting how proteins are folding. And this right now is in a different scale that we had in the past. We are starting to see how the large language models that we saw 2 years ago doing basic things, they're starting to move into rational thinking. And rational thinking is important for researchers, right? So we are going to see amazing years, probably in a way that people will start to use AI in unexpected ways.
Well, it's really interesting to hear because it sounds like the AI will be increasingly taking on less narrow tasks and more broader guiding tasks. A final question that I would like to ask you is this. If AI is fully embraced in all the ways you believe it should and could be over the next 5 years, how might it positively impact a family whose child is born with a rare disease, such as Dravet syndrome? How might a family like your own be different should, in 5 years' time, their child be born with any rare condition, Dravet syndrome or otherwise?
I divide this situation in two moments. One is before diagnosis, another is post-diagnosis, right? Because for rare diseases patients, the time to diagnosis is very important. So I guess in 5-10 years, the diagnosis process will be done by computers, or mainly. Maybe the final clinical diagnosis is done by a human, but just to sign the report. It's the same way that when you have a blood test right now, the only activity the humans do is sign the report. Everything is done by machines, not any human is counting red cells right now. In the same way, probably we are going to see high levels of automation on diagnosis, especially because of genetic analysis. I mean, genetic analysis is complex. There are multiple variants, there are multiple diagnosis processes, and the need of AI to facilitate that process is emerging. After diagnosis, the clinical management of the patient, in most of the cases, probably will be done by an AI because it's so complex for a patient with a rare disease that humans can't do alone. For example, I did an experiment with one of the AI tools that everybody is using right now, which is Notebook LM. You put information on that tool and you can ask questions, summarize, and do a lot of things. This is a tool we use for my medical issues and also the medical issues of my son. It's a very amazing tool because you can also ask to create a podcast.
Yes.
Oh, yes.
So I should be nervous.
No, you probably are doing better than this. But it's very interesting because you can see how the AI is creating an artificial podcast with two artificial podcasters. And I will send you an example of my condition because I put my medical records on there and I asked them to create a podcast about my condition. And this is impressive. They are discussing my medical condition, but in a very holistic way. The podcasters started to discuss about the impact of my son in my health, which is something I guess nobody did it before, When patients are going to see this and experiment, they won't be able to go back anymore. In most of the cases, innovation is from an external agent. It's not coming from the people who is in the system because they are not able to see new things. Innovation in most of the cases comes from outsiders, from people out of the game. And probably this is something that we will start to see in healthcare space in the next years.
Well, Julien, it's been really fascinating talking to you. You've definitely not downplayed some of the fears that people have about AI creating some upheaval in society or in medicine, but it does sound like it should definitely be something that the rare disease community looks out for opportunities within because it's potential to positively transform the lives of countless people with rare diseases sounds definitely there, essentially. So thank you so much for outlining for us the potential that is there for artificial intelligence and the rare disease community. It's been really interesting talking to you today. Thank you, Julián.
Thank you for having me here. Thank you so much.